I'm Abhilash Samikuti, Research Associate from Stephenson Comprehensive Cancer Center, University of Oklahoma. Thanks for Pancreatic Association for giving me an opportunity to present the topic, tumor-specific nanodelivery of Echinomycin induces autophagy mediated death in chemo-resistant pancreatic cancer. In this study, we investigated the use of syndican-1 peptide to actively target a liposomal formulation of drug Echinomycin to insulin-like growth factor receptor IGFR1 for treatment of pancreatic cancer. As autophagy is a chemotherapy escape mechanism in some cancers, we evaluate Echinomycin in pancreatic cancer under chronic autophagy. In this slide, we synthesized liposomes and characterized by scanning electron microscopy or dynamic light scattering. The average size of the liposome was 111 nanometer to 129 nanometer. And in this slide, we determine the level of syndican-1 in various pancreatic cell lines by flow cytometry. We have used S2VP10, S2CP9, MIAPACA2, and a negative cell line MCF7. And we could able to find S2VP10 had 63.7% and S2CP9 had 47.3% of syndican-1 in comparison to rest of the cell lines. So based on these results, we use these two cell lines for rest of our experiments. In this slide, we have shown a mechanistic evaluation of syndican-1 liposome combination with or conjugation with the Echinomycin drug induces autophagy, and it's shown by Western blot. S2VP10 and S2CP9 cells after the treatment with syndican-1 liposome Echinomycin induce autophagy by inducing the level of LC31, LC32 in comparison to Echinomycin or Gemzar alone. In this slide, we did an Amigo experiment. S2VP10 and S2CP9 cells orthotopically implanted in mice, and once the tumor was developed, syndican-1 liposome and Echinomycin combination were used for the treatment. And after the treatment with SDC1 liposome Echinomycin, significantly improved the survival of the mice in comparison to Echinomycin alone or Gemzar alone or PBS treated control. We did a biodistribution study where syndican-1 liposome were conjugated with IR780 imaging dye, and in orthotopic pancreatic tumor models, we could able to detect the tumor by a novel imaging technology called as multispectral optoacoustic tomographic imaging. And at 49 mm slice, the maximum amount of dye IR780 dye is released inside the tumor. We did a tissue distribution study where larger amount of IR780 imaging dye is released inside the tumor, whereas liver and kidney had very less concentration of IR780 dye. So in summary, we have synthesized liposomes and conjugated with syndican-1 peptide and conjugated with Echinomycin drug. And in pancreatic tumor cells, after the treatment with syndican-1 liposome Echinomycin combination induced autophagic cell death. Similarly, when conjugated with the IR780 imaging dye, we could able to detect the pancreatic tumor by multispectral photoacoustic imaging technique. And collectively, these results support the notion for actively targeted nanodelivery of Echinomycin for chronic autophagy cell death without apoptosis or necrosis. When widely viewed across cancer care, these approaches could contribute to the treatment for many difficult to treat cancers. And thanks to my lab members for helping me with this work. Thank you.